Hi everyone, Dr. Simon Freilich here from the Neurophysiology channel. In this video I'm going to be talking about sciatica. Now when we're talking about sciatica, this is something that affects lots and lots of people, but there's a lot of uncertainty as to what we're referring to. Are we referring to the sciatic nerve as an anatomical structure? Are we referring to it as a process? Are we referring to it to a disease, or are we referring to it as a symptom? So first things first, sciatica is a symptom. It refers to people who are having a pain or discomfort radiating down the back of the thigh into their legs. Sometimes it can include back pain itself, but sometimes it's just the discomfort just radiating down the back end of the thigh into the lower legs. The reason it's called sciatica refers to the sciatic nerve, but it's not necessarily a disease of the sciatic nerve itself. In fact, it's very rarely a disease of the sciatic nerve. Now, the sciatic nerve comes from the Greek origin relating to the hip. So in terms of the anatomy of it, this is the nerve of the hip, the sciatic nerve, and people who are experiencing sciatica are having this discomfort radiating along the similar course that the sciatic nerve itself would take. But as I said before, the vast majority, over 90% of people who have and experience sciatica, it has absolutely nothing to do with the sciatic nerve and actually has a lot to do with degenerative spine processes. Let's have a look at the anatomy now. So we have the nerve roots. These are the nerve fibers that come out from the spinal cord. We'll take a look at that in a bit more detail soon. And they come out from L4, from the fourth lumbar vertebra, and down to S3, the third sacral nerve root. And they come together in the sacral plexus and then form the sciatic nerve just in front of the piriformis muscle. Now this view that you're seeing over here is from the back end, we're looking forward, so the sciatic nerve is forming just in front of the piriformis muscle, and then it descends downwards down the back end of the thigh into the lower leg below. And so this is why people are getting this discomfort radiating down this pathway from the discomforts generated by the degenerative processes affecting the spinal nerve roots, and then those symptoms are radiating the way down the back end of the thigh. So that's the anatomy really of the sciatic nerve. Now I'm going to be talking about the piriformis muscle in a lot more detail in the next video or so, but in terms of the actual degeneration of the spine, let's start off with having a look at the basic structure of the back. So we've got these bones over here, the vertebra. In between the vertebra we've got these discs, these intervertebral discs, and they act as cushion systems. And then we have the spinal cord, which rests really in the canal, which is formed by the back end of those bones. And through it we have the spinal nerve roots coming out, and they go to their eventual destinations. But at the points where they come out, they're actually quite susceptible to being crushed by the hard bone structures around them. There are lots of possibilities in how this process of degeneration can occur. First of all, the most simplest one really is dehydration of the discs, and therefore one has a reduction in the distance between the bone surfaces through these tiny holes, and therefore irritation and damage to the nerve roots as they come out. We also have degeneration of the vertebra. This may be due to osteoporosis, amongst many other causes, and as the vertebral bodies reduce in height, again, one has reduction of those canals that the nerve roots have to come out from. We also have osteophytes, where they have these bony overgrowths which can occur. They're much more common in people who've got arthritic processes. And then we have spondylolisthesis, and this occurs when the structures which normally keep the vertebra in alignment fail, degenerate, and then one can have slippage, usually forward slippage at the L5 vertebra, which then causes crushing of the nerve root as it exits its way forward. There are also other alternatives too. If we have a look from a top-down perspective, the most feared one, of course, is disc herniation, and that's the one that people really think about. You know, if someone's having a slipped disc, so usually what happens is that the inner cushion, the nucleus pulposus, the sort of gel-like substance, sort of pushes its way backwards and sideways, what we call dorsolateral in medical parlance, and then it pushes through the tough annulus fibrosus, this sort of ring which holds this gel-like substance together, and then ends up pushing on the nerve root, but that's not necessarily the most common cause of degenerative spinal problems. Usually it's just an accumulation of gunk, thickening of various ligaments. We've got ligamentum flavum from the very posterior part. That can cause stenosis and crush on the spinal cord itself, or on the nerve roots, or on the posterior longitudinal ligaments. We also have degeneration of the lateral recesses, or we'll also have facet joint disease, where the facet joints can become degenerative. So that's a brief summary of what sciatica is and the sciatic nerve. They are not synonymous, they're two different things. If you want to find out more about evidence-based treatment for degenerative lumbar conditions, lumbar radiculopathy, I've got a separate video dealing with that, which you can click on the link up here. And I look forward to you joining me in future videos looking at the sciatic nerve. If you want to find out more about foot drop, again, you can find out more on the video over there. There's a little series about that. But in the meantime, thank you for watching. Please do support the channel by liking, sharing and subscribing, and looking forward to seeing you soon. All the very best.